It is Wednesday, and that means it's time for Morning Rounds, and Dr. Larry Shields joins us this morning with more.
Good morning, sir.
Hi.
And we're talking about gestational diabetes, something that doesn't affect everybody, correct?
It's not going to affect you, that's for sure.
All right.
It is going to affect about 10% of all pregnant women. And it's going to be a complication of their pregnancy that they probably didn't expect, because you don't, unless you walked in with pre-existing diabetes, you don't really think of yourself as having diabetes. But the hormones of pregnancy sort of put a stress on the production of insulin and the way insulin works in pregnancy, and so you'll see development of diabetes in that population of patients.
Okay, so let's really quickly go over diabetes in pregnant women. What types of what can we expect to see if you were to have gestational diabetes? What are some of the side effects or some of the...
Sure. For the mother, there's not a lot of issues. For the baby, it's big issues. The elevation in mom's blood sugar gets directly transferred to the baby. Just like mom, you respond with insulin, but for the baby, insulin is their primary growth hormone. Okay. So you get very large babies, so they have difficult times coming out at birth, so they can have injuries to their nerves in their neck, broken clavicles, humeruses, just trying to get them out from their sheer size. Okay. And then after they're born, they have the opposite effect. They're used to having huge amounts of insulin being produced to counterbalance the sugars they're getting from their mother. So then their sugars go really low. Okay. And in severe cases, there can be some other metabolic abnormalities.
So I guess, how would somebody know if they have this form of diabetes?
Have to be tested. You're not going to walk, just like diabetes in general, you're not going to walk around and know that you have it unless you get tested for it, or you have, one of the really severe complications from it. So part of standard screening for all pregnant women is testing for gestational diabetes.
Very important to get that testing. Now, we were talking about this in the break. Is this something that most women, or which women, I don't know if someone who's overweight, or you mentioned maybe predisposed to diabetes, who's at the highest risk for developing?
Highest risks are going to be certain ethnic groups. Hispanics, very high incidence. Filipinos, very high incidence. People that are obese, higher probability that you're going to get this. And people with strong family histories of diabetes. Okay.
And so treatment, is there something that women can do if they develop this form of diabetes?
Yeah, most people are going to respond well just with modification to their diet, just like you would if you're not if you're not pregnant and have diabetes. Modify your diet, exercise. And then if people that don't respond to that, there's a variety of medical approaches that you take with both pills or oral agents versus insulin, and people tend to be on combinations of the two.
Now, we understand that there's a new program at Marian Medical Center that expectant mothers can go to?
Right. Typically, what happened to particularly the people that had diabetes before pregnancy, they either come up to San Luis Obispo, where there's been a long-standing diabetes program, or go down to Santa Barbara to get treatment, or just sort of make do with here in Santa Maria. But now Marian has opened Sweet Success, which is a state-sponsored program for diabetes and pregnancy, and so there's going to be much more expanded services in Santa Maria for treatment of mothers with diabetes. Okay.
Now, I know you had mentioned 10%, about 10% of women who are pregnant may get this. Really quickly, though, are you guys seeing an increase in women? Is that a higher percentage than previously, or is that pretty typical?
You're seeing more as a result of the increase in obesity, which is flowing through to the obstetrical population. Yeah.
So very important to stay healthy, even and especially when you are pregnant.
And have your screenings done.
And have your screenings done. Your doctors generally get your screenings done.
Thank you very much, Dr. Larry Shields, for joining us this morning, talking about gestational diabetes. And if you have a question about your health, send it to morningrounds@KCOY.com.
Thank you again for being with us, and we'll be right back with a check of your FastCast and a check of weather coming up.